Over the last 24 hours, we have identified 291 new cases of COVID-19. We completed about 5,900 tests, and our positivity rate is about 4.9%. Looking to schools, there are currently active alerts or outbreaks in 236 schools, or about 10% of schools in the province. These schools have a combined total of 890 cases since January 11th. We have identified 35 additional cases of the variant since yesterday, bringing our total to 457. For the past week, the RT value for the province was 1.01. This includes 1.16 for Edmonton, 1.01 for Calgary, and 0.94 for the rest of the province combined. As the Premier noted, currently there are 257 people in hospital, including 48 admitted to the ICU. Sadly, I must announce that 2 new deaths were reported to Alberta Health in the last 24 hours. While it is encouraging to see the rate of COVID-19 fatalities declining, this does not lessen the loss that many Albertans continue to feel from losing a loved one. My condolences go to anyone mourning the loss of someone they cared about. A vaccine is our best path to preventing these severe outcomes, and I am happy to say we have administered more than 235,000 doses of vaccine in our province, with more than 88,000 Albertans fully immunized. Since the rollout of the vaccine to Alberta seniors aged 75 and over, February 24th, more than 123,000 eligible Albertans have been booked to get the COVID-19 vaccine. In just over 5 days, Alberta has provided a first dose to upwards of 31,000 eligible individuals in that age group. We anticipate that another 8,000 were given today. We thank Alberta seniors for their patience as we work through some challenges during the first few days of clinics. I'm pleased to report that the long lines at some clinics have been minimized by new processes that have been put in place by Alberta Health Services. We appreciate people arriving only 5 minutes before their appointment and waiting in their cars until just before their appointment time. I understand everyone's desire to be on time. For many people, getting their first dose is an exciting day, but this is why we have an appointment system. Please know that if you have an appointment, vaccine is reserved for you and you will get your immunization. While we roll out the vaccine, we need to continue to ensure the health and well-being of one another. I ask all of you who have immunization appointments in the coming days to continue to follow physical distancing guidelines. Also, if you are comfortable going into your appointment alone, please do not bring a support person or family member with you, as there are staff who can help assist you, and this can prevent overcrowding. We also encourage everyone to wear clothing that will easily allow access to your upper arm for receiving the immunization, like a short-sleeved shirt. For those who are eligible for the vaccine but haven't yet booked, appointments are still available throughout the province. There are 3 options to book your appointment for receiving the vaccine. These are using the AHS online booking tool, calling HealthLink at 811, or contacting currently participating pharmacies in Edmonton, Calgary, or Red Deer. A list of participating pharmacies is available through the Blue Cross website at ab.bluecross.ca.
If the numbers start going clearly back in the right direction with diminishing new cases, and if we can clearly establish that the variants of concern are under control, that the inferred rate of transmission and those other key metrics, if they start going down in the right direction, I think we can absolutely look forward to taking additional steps within the phase 2. But given the recent plateauing of total active cases, the recent slight increase in the testing positivity rate, the RT rate, we thought it was best to proceed at this point with caution. And we have to be constantly mindful that the only health risk here is not COVID-19. The mental health impacts, particularly for isolated seniors, the deterioration in their physical condition that's often attached to that, limited compassionate visits. We know that not only is that inflicting real pain and sacrifice on their loved ones, but most especially on seniors in those kinds of congregate living facilities. So I do hope that I'm looking forward to further advice from Dr. Hinshaw and her team on when it would be deemed safe to move forward with relaxing some of those measures.